Dr. Morgan Sauer, who is the medical director for Baptist Health Hospice, and he was here to discuss what hospice is and what are some common misconceptions of hospice. An important conversation. A lot of people don't like discussing hospice because we're talking about some end-of-life healthcare services, but it is an important discussion to have, to know what your options are if you have a loved one who's heading in that direction.
From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Well, welcome back to Good Morning Arkansas. Dr. Morgan Sauer is here with me this morning, and November is National Hospice and Palliative Care Month. But many people do not know the importance to the healthcare system, but this is the month where we're talking about it. Can you explain a little bit about that?
Boy, this conversation is so important. The U.S. healthcare system is just really not designed to provide great end-of-life care. We've done a terrible job at it, but we're trying to be a lot better. National Awareness Month for Hospice is really important for that.
All right, explain to me, some people may have heard about it, but let's just break down the basic definition. What is hospice care?
So in a nutshell, hospice is a philosophy of care. It's not exactly a place. And what it says is that when we have conditions that we know we cannot cure, and we know that are not going to get better, people have the option to avoid prolonged suffering and prolonged discomfort and say, I want to focus on my quality of life. I want to live the best life possible, as comfortable as I can. That's when the hospice team can step in and really do an amazing job at helping close the chapter of a beautiful book.
Relief seems like it would be very important to most people, and hospice is a huge part of that. Obviously, it comes at a time of life where people, can be saddened by the prospects of a loved one maybe getting close to the end of their days, but it can be a good thing, a hospice care. And how do people find more about that, a team that can do that?
The first thing is to think about what happens if you were told you had 30 days left to live. So much of the extraneous garbage that we fill our lives with goes away, and it's the time that people can open themselves to a really beautiful experience and have great quality. It's our jobs to make sure that any type of symptom, obviously we think about pain, but what about spiritual crisis, existential crisis, interpersonal relationship problems, nausea? There are a lot of other things that we need to focus on, and the hospice team works using different disciplines of the healthcare system to make sure that these symptoms are alleviated. Okay,
well that's very cool. Hospice, of course, for the people at the end of life, but what's the time frame that hospice care is for?
Unfortunately, a lot of people have the wrong misconception and think that we've got to bring hospice in, but only in the last 5 hours of life. Obviously, if you've had an acute heart attack or stroke, okay, there's not a lot of time to plan ahead. But most of the illnesses that cause us to leave this world, we know way ahead of time what's going to happen.
So it's a terminal illness, something like that, where you get hospice set up well in advance for someone to come home. But is hospice an option for somebody who something happens and it's abrupt?
Yes, there is absolutely scenarios for abrupt. But the hospice benefit actually is for 6 months for people who have what we anticipate to be 6 months. Now, obviously, if someone lives 6 months and 3 days, you don't throw them off of hospice. It just says this is a time to sit down, look at the data, see, has someone gotten better? It is not uncommon to see people get better on hospice, especially when they get away from all these treatments and procedures and that have these horrible side effects that may actually be causing more harm than good.
Yeah, you see people, cancer comes to mind, where it's hurting their body and they just want to come off of it and they want to be comfortable as they finish out life. So that's one thing that comes to mind. Is there any other type of situation that comes to mind?
Well, a lot of people associate hospice with cancer because that's really kind of where it started, grassroots in the U.S. However, cancer is not the #1 killer in the United States. And so cardiovascular disease, Alzheimer's disease, Parkinson's disease, there's lots of other illnesses, emphysema, that continue to progress that we just don't know how to cure. And when they get to a certain point, hospice care can come in. There are even national organizations like the National Quality Forum. When we look at cancer care, we know what's coming along. And so hospice should be started based on evidence-based medicine for the standard of care at least 8 weeks prior to the end of life to help people experience the best life possible.
Yeah, so 8 weeks is ideal. But you've seen this for shorter periods of time, where it's just a couple days.
Well, actually, 8 weeks is relatively more of a minimum, and recommended the data that shows the best utilization of hospice is at least 3 months before the end of life. But even if it's one of those things that you only have 12 hours, hospice can still be helpful for you.
Okay, so you can talk about it in magnitude of hours as well.
Absolutely.
All right, well, if someone is considering hospice care, what should they do, and what do they do if they have questions about it?
The first thing is know what you don't know. And most people have a lot of misconceptions. Oh, they're going to stop all of my loved ones' medicines, or they're not going to let me do this or that.
So we're going to debunk some of those myths.
There's a ton of these myths, and you need to get expert knowledge on how to do this. Baptist Hospice at 501-202-7474 is a great place where my team and I can start to work with people, provide them information. Sometimes people just want to get a little information. Have a friendly face or a friendly hand to reach out to when the time comes. And that's what we do.
And there's nothing wrong with just getting the information. You can call the number that's right there on your screen. And we opened up with this, palliative care. What's the difference between that and hospice?
So palliative medicine is the branch of medicine, which is actually a newer branch of medicine that recognizes there's just some things that we can't cure. So what we do is we try and cover up the symptoms, make the quality of life the best possible.
How to take away the pain.
Exactly, or nausea, or constipation, or the existential crisis. This can actually be done even when we know we're going to cure somebody, but the treatment is going to be rough for a certain period of time. Hospice, however, is a branch of palliative care, and hospice is specifically dedicated and designed to taking care of people who are within the last 6 months of their life.
All right. Well, hey, that's Dr. Morgan Sauer. He's here talking about National Hospice and Palliative Care Month. Thank you for joining us this morning. Some good stuff. Remember, you can call that number for Baptist if you have more information.